What is DVR? We are a state agency that provides employment services to individuals with disabilities. We are a federal program that is administered by the states. So each state has a program similar to DVR, Division of Vocational Rehab. It could be called different things in each state. In Wisconsin, it's called DVR. We are all about work. We're about helping individuals get a job, keep a job, or get a better job. Our goal is to help individuals with competitive employment based in the community that's integrated and is commensurate wages with other employees doing that same job. So enclaves would not be an employment outcome. Sheltered work is not an employment outcome. Or sub-minimum wage is not an employment outcome. Or doing a job in with an employer at a different wage than the other people doing the same job are doing. So our goal is community-based, integrated, doing a wage commensurate with other people doing the same job. How do you apply for DVR? Wendy mentioned the Transition Action Guide. According to that agreement, at least 2 years prior to graduation do we recommend individuals apply to DVR services. It can be earlier based on the individual need, and I suggest if you think that prior than 2 years is necessary, have a conversation with a DVR counselor assigned to your school. Every public school in Wisconsin is assigned a DVR counselor, and many of our private schools are also. You can apply in person. You can go to our local DVR offices. We have 11 different areas, and each area has at least 2 offices in that area. Go to apply in person. You could call the local office and request an application be mailed to you, or we have online applications. Any of those can be done. Okay, our first appointment. The first appointment is really starting the eligibility process. It's really gathering information that we need to determine someone eligible for DVR. We will ask disability information, educational information, what your work experience is, if an individual has jobs, maybe if you had any difficulties on those jobs, what those were, so we can gather that information. Or any other relevant information. If you receive Social Security, what other types of benefits you're receiving. And with the schools, generally those occur right at the school. There might be instances where you get requests that you come to the offices, but for transition youth, most of those appointments actually occur in the school. And parents should be invited to those appointments, or the guardian. In most cases, if a person is over 18 and there is no guardian, we're not required to ask, but if you want to be part of that, we encourage families to be part of that process and be involved. We are an eligibility-based program. So to be eligible for DVR services, you must have a disability, and that disability must cause some sort of barrier to employment. So those are some of the conversations we would be having at that first meeting. And if an individual receives Social Security, SSI, or SSDI based on their own disability, they are presumed eligible for DVR. So those might be some things that we'll be asking in the initial meeting. And we do have a verification process also, but I want to let you know that is presumed eligible for those individuals that are receiving that benefit. A lot of you may have heard about our wait list. We do have a wait list for DVR services, and that's a federal mandate if you do not have enough resources to serve everyone that wants our services. And actually, in DVR's case, it's more of a human resource issue. We don't have enough staff to serve all the individuals that want our services, so we are mandated to have a wait list. And it gives priority to the individuals with the most significant disabilities first. So if we consider an individual having the most significant disability, they will be immediately activated for DVR. If you're considered having a significant disability, the wait right now is between 4.5 and 6 months. If you're considered having no significant limitations related to your disability, we've not been able to serve those individuals for about, I want to say about 6 or 7 years. The wait is pretty long. Give an idea where everyone falls, about 25% of the individuals we serve are in Category 1, and about, I would say, 75% are in Category 2, with a small portion being Category 3. So most individuals get the services for the DVR within 4.5 to 6 months of applying. That's of the application date for services. These are the areas that we look at in determining order of selection. There are 7 different areas: mobility, communication, self-care, self-direction, interpersonal skills, work skills, and work tolerance. These are a lot of the questions that we'll be asking during that first appointment, how your disability affects these different areas. If you have 4 limitations, or 4 of these areas that we identified limitations in, that's category 1, so you're immediately activated. If you have 1 limitation in any of these areas, that's category 2. If you have no significant limitations, no identifiable limitations in any of these areas, that's category 3. So as you can see, most of the people that do apply are going to fall into the category 1 or category 2 area. So once someone applies and either they're found in category 1 or put in category 2 and activated, once they come off the wait list, we start vocational planning right away. And this is really where it's essential that we engage family members, other people in our life, the school, because these are the individuals that know the person we're working with the most and can help us with the vocational planning. It's really help identifying the career goal and the services needed to reach that goal. And Shannon mentioned before assessments. This is a time period where assessments would be provided. And assessments could be vocational assessments, it could be assistive technology assessments, it could even be a driving assessment to identify the goal and the services needed to reach that goal. A question came up before, what to do if a vocational assessment comes back saying the person is unemployable or non-employable. We have actually taken a stand where our providers are not allowed to say that in their assessments. That if we send a person for assessment, we presume everyone is employable. And we want to know what it's going to take to get that person a job and keep that person on that job. They are not allowed to give us recommendations such as day service, sheltered work. It's what needs to be done to get that person into a job and keep a job. This is the time where probably the most intensive vocational guidance and counseling occurs by our counselors. All our counselors are master degreed vocational guidance counselors licensed by the state of Wisconsin. So we provide a lot of counseling to our staff or to our consumers, and this is most of the time the most intensive time where this may occur, because we're really going through the different barriers. Maybe there might be some adjustment issues or different things that need to be addressed in this period to get that person ready for employment. So this is really where we're focusing on getting that person ready. And identifying those different barriers, we address them in the order of selection and how we're going to deal with those barriers when it comes to employment. This is all supposed to occur within 90 days. However, we can request some extensions if necessary. So if there's a lot of assessments that need to be done, or intensive assessments, or counseling, or just time to do some of the career exploration skills that Shannon was talking about, visiting jobs, doing job shadowing, informational interviews, we can ask for an extension if needed to get that IPE done. This is very similar to the IEP. This is our version of our plan. It's going to give us detailed directions on where to go. So let's say, for example, I'm your DVR counselor. If for some reason I would leave the DVR or be on vacation or go on medical leave, someone can pick up and know exactly what that plan is. It's going to identify what the employment goal is, what services have been agreed upon, the timeline that that's going to occur, progress measures, how we're going to know that progress is being made, responsibilities of the consumer, the individual getting the services, and the DVR. This is going to be all outlined in that IPE. This must be updated at least once a year or whenever any changes need to be made. How many of us, when we were graduating high school, changed our career goals? I know I did several times. I always said I needed a vocational counselor when I was in high school and college. We anticipate. So this can change as necessary if things they try something, it doesn't work out, have to back up, or someone gets exposure to something new, we can change directions if necessary. When I was a transition counselor for 10 years, a lot of transition youth either want to do one thing or a lot of things, and that's because their exposure to jobs is very narrow. Everything sounds good or nothing sounds good. So, part of our job is to help them expose to different things or help them narrow it down. So, and sometimes that just takes time, or it might occur during the course of an IPE, and that's when we can work through and make some adjustments if needed. We really can provide almost any service needed to help that person reach an employment goal. Some of them that are on here is our job development, job coaching, training. Training can be anywhere from on-the-job training to skilled training in the community to associate's degree at the technical college to bachelor's degrees. It's really whatever is needed to reach that employment goal. Counseling and guidance, a lot of times, like I said, it can occur before the plan is developed or when things don't go as planned. Sometimes counseling is needed to help that person get back on track. Support and employment on here. This is really the most critical time where that coordination with the DHS agencies, whether you're in a waiver county, family care, IRIS, we really need to have that close coordination when we're looking at someone who is requiring support and employment services. And support and employment services are those services when we anticipate that someone's going to need support on the job long term. Before a DBR can engage in a plan that has support and employment on it, we need some sort of reasonable expectation that there is long-term support available for that consumer to maintain that job after DBR closes the case file. We don't want to have someone out there hanging without support. We need to make sure that that's all in coordinated before we start the process. So that's why it's essential that we have communication, coordination prior to these discussions of services at the planning stage. So that's one of the reasons that we decided it's really essential to have the transition action guide and getting it out there, starting to work together, because we want to make sure that the plans are successful from the beginning point. I'll also mention about temporary work and OJT. Temporary work is, as Shannon has said, a temporary job or an internship, for example, like a traditional internship that helps a person gain exposure to different types of jobs. But it's also great in helping develop soft skills, which are showing up in time, learning to take direction from a supervisor, and also hard skills, learning the actual task on hand. These are generally time limited from usually 6 months to 3 months. But a lot of times we just do multiple temporary work experiences. I'm a true believer that, while temporary work experiences are great, we should also incorporate permanent jobs into transition plans, because it's been my experience as youth are getting comfortable in the temporary work experiences, generally that's when it ends. So you don't get the benefits of those long-term jobs, the benefit of having it be your own job, the pride of going to work 6 months, 7 months down the road and having some of those different learning experiences that occur when you've been on the job a little bit longer. So, and plus it's that work history. When you're going to be hiring someone, I'm not sure, how many in the audience have hired people. You're more apt to hire someone who's been on the same job for 1.5 years versus a series of 6-week to 3-month jobs. So we want to make sure that youth with disability is on the same playing field as their peers who have had those permanent longer-term jobs. OJT is an incentive to employers for those individuals who that may take longer to learn the job. So it's to offset some of the on-the-job training that may take place. So we are able to subsidize employers for some wages during that training period. It's a little more complicated than that, but for the sake of time, that's how I'll explain it. Comparable benefits. This is just, if there's another resource in the community, we must seek that out as a first payer before we provide that service ourselves. And there's some cost-sharing agreements between agencies to make that a little bit more streamlined. Okay? And then successful closure. Once a person is on the job for 90 days in a traditional job, meaning not supported employment, we close the case. If the person is in supported employment, where there are long-term supports, it's whenever we transition that person to the long-term support. Then we follow them along for an additional 90 days to make sure that aren't any additional issues or complications that come up where we may have to get re-involved. So we make sure that that transition has gone smoothly. And that occurs anywhere between 6 months to 18 months after that person gets that job, depending on what the need is. And I also wanted to mention before that, Shana mentioned there's a 61% success rate for youth with disabilities. And I just want to stress, that majority of the people that are closed non-successful are because we lost some sort of contact with them. I don't want people to have an impression that we close cases because they're not successful, that we determine someone unemployable or we've given up. I just want to make sure that people understand that usually it's for other reasons, like we've lost contact or maybe their disability is where they decided that they're not going to pursue employment at this point and they apply at a later date.